Your patient waited 45 minutes for their handy bus to bring them to the health clinic. On arrival, their wheelchair wouldn't fit through the restroom door, and your examining table wouldn't lower. This is just their medical appointment. Can you imagine the rest of their day? I'm Christine Gibson, a family doctor in Calgary, Canada, where I practice social innovation, which is system-level thinking about complex problems. And I innovated the Solution Studio. At the Alex Community Health Centre, we provide wraparound services for health and social issues for a population that faces poverty, housing and food insecurity, and intersectoral discrimination. We have a team that includes social workers and case managers, and we collaborate very closely with outside organizations. I believe that if we are to be a true health system rather than a disease management system, we need to really shift our focus from where we are now to addressing the root causes of ill health at their source, which would require a shift from social isolation to community, from adverse childhood experiences to resiliency, from addiction to purpose, and from vulnerability to ability. At the Alex, we encourage individuals and communities to discover what is healing through creative expression, movement, nutrition, and enhancing agency, which is whether a person feels they have control of their life. Take chronic pain as an example. This can create difficulties in relationships, underemployment, disruptions in sleep. Prescribing pills or physiotherapy may not address what is important functionally or existentially. In the Solution Studio, we use a process similar to Social Innovation Lab, but it's been modified, where we invite community members with a shared lived experience to the health center, and I walk them through an empathy map process. So we're dealing with a hypothetical case instead of something personal. We then use the iceberg model of leveraging systems. So we go from trending topics to system and policy interventions, delving deep into the mental models that could affect inequity. In the Solution Studio Mobility, they dreamed of transformational ideas like co-op housing with disabled folks and grannies and single moms and students who might all live together and solve each other's problems. Also smaller opportunities like how to clear sidewalks better. So we got a grant that they used some head-mounted cameras to film mobility through the harsh winter, and they're going to ask the City Council to take a wheelchair to work for the day. In the chronic pain studio, they all turned out to be men, so they've asked us to form a long-term support group and for information on cannabis legislation and a space to sing out their pain. So we have a volunteer singing teacher. These are solutions I wouldn't have been able to think of because I don't have the lived experience. But I wonder who else in our community needs to be heard. The formal health system does not address resilience, agency, or community building. But what brings well-being better than dignity, purpose, and connection?